You see, now that's the thing too, right? Because a lot of people will focus on people who are uninsured. Like you always hear uninsured, uninsured, uninsured. But if you actually start talking to people, especially I talk to a lot of patients, and when I start, I ask them like, oh, so what's your deductible? Like even hearing what your deductible is like a new term for them. Because typically when they're looking for insurance, they're just seeing like, oh, which one has the lowest copay? Like that's what they're looking for. Or more, not even necessarily copay. Which one has the lowest premium? So which one is going to cost me, the least every single month? Not realizing that every time they factor in, like, all right, let me make sure, my PCP is still on my plan. Let me make sure this plan is low enough. The reason why that plan gets low is because it has to raise what you have to pay out of pocket. And that out of pocket cost, whether it's per individual, whether it's, and I'm not sure if we got insurance folks on the timeline, but if we do, like, one of y'all should definitely give a much better breakdown than I can. Whether it's individual, whether it's per the family, that can be $2 to $3 to $5. I've seen some $10,000. So a lot of times it's a lot of money out of pocket before the insurance company will turn around and say, all right, we're willing to cut you a check for 75%, right? This is them, right? So mind you, you've had to pay all of that money out of your pocket and insurance still ain't coming 100% away, right? They're still saying like, all right, we got you for 80%. You still need to do the rest, but we got you for the 80%. So that insurance not being worth a damn. And now I'm in Florida. There's lots of different reasons why, and we can definitely go and talk about why our insurance is worse here than other states. It has to do with our Republican governors, right? It just is what it is. But like that's a problem that I don't think gets talked about enough because a lot of times people are always focusing on the uninsured, like the person that has zero insurance.